Hi, I'm Karen Greenhalgh again, and this is the last video before I go into surgery tomorrow. I promised to get everyone caught up on how I ended up here after finding out I had cancer. So if you looked at the other videos, you know I found out I had cancer in November of last year. The different tests that I had to go through, and confirmation that it is cancer, cervical cancer, and that I needed a major surgery, complete hysterectomy, but that I also have a relatively rare genetic bleeding disorder that is making surgeons very nervous. So to pick up from that, the end of the last video, I went through 4 surgeons before I found one who would do the surgery. 2 would not even make an appointment with me once they saw my records, and 2 actually canceled when I was sitting in their waiting room. None of the 4 ever actually talked to me. Because of my bleeding disorder, I have a hematologist who also is an oncologist, and he found a cancer surgeon to do this surgery for me, which is a step ahead. Typically, doctors like my doctor I've had for 40 years would do the hysterectomy, see if there was cancer, how extensive, and if I would need a referral to the cancer doctors. So I'm just kind of skipping that step, going straight to the cancer doctor, who is the cancer surgeon, is working hand in hand with my hematologist. They've come up with a plan to deal with my bleeding disorder. So my surgery is typically outpatient for people. It's a hysterectomy. But for me, I have to check in early. They're going to do an infusion, which means they're going to put into my blood something that will make it clot. Then I'll have the surgery. Then that evening, I have to stay overnight. So that night, they'll give me another infusion. And then 12 hours later, the next morning, I'll get another infusion. And then, assuming all goes well, I will get out Saturday afternoon. But I have to go back to the my hematologist office on Monday morning and have another infusion. And then go back Wednesday morning and have another infusion, and whether or not I need one Friday, they will decide on Wednesday. So that's totally up to the doctors. And I can't drive, which means, so my daughter and my sister are going to cart me back and forth to all these appointments. There's no reason to think everything's not going to go smoothly. It's just a bit more of a hassle for me than it is for other people. My doctor, the one I've had for 40 years, who found this cervical cancer, he actually called me himself yesterday just to see how I was doing. You know, that just encouragement that everything's going to be okay. But he is concerned because we had the scare in 2023 where he thought I had cancer, but it didn't come back when he did the biopsy. So it's in the back of his mind. Has this been growing since 2023? Or is this really a new event and we're catching it now? We won't know until weeks after the hysterectomy. They ship it off somewhere and find out. Then, you know, within a month, I will know what they found and what, if anything, I need after that. So at any rate, it's been a long haul. My doctor and I have been really nervous trying to get the surgery scheduled. He had wanted in December, and I have it tomorrow. But yeah, it's been long getting here, and sure, yeah, I'm nervous. I'm really worried, but I'm going to be surrounded with family. They're not going to leave me alone. They're afraid I'll fall and maybe I'll tear something inside and start to bleed. So they're going to watch me like a hawk for a week. But I was talking to my pastor the other day, and as scared and nervous as I am, I do know Jesus Christ. I was saved when I was 8, and I grew up with Jesus. He's been with me. God's been so faithful. I could tell you all kinds of stories of things I've been through and times when I wasn't as faithful to him as I should have been. But he was always there. and he's always been with me. I said something once a couple of weeks ago about don't let someone dealing with cancer go to an appointment alone, and I stand by that. It was really hard to go to those appointments and sit in the waiting room by myself and think about all the things I was worried about and not have anybody's hand to hold. But I really wasn't alone, and I knew I wasn't. And I wonder how people who don't have the confidence I have, God is with me. Even when I feel alone, I'm not really alone. And he knows what's going to happen on the other side. He knows how this surgery is going to go. And I think he got me in the doctors that I needed to be with, who knew how to handle this genetic bleeding disorder that I have. But just, you know, I mean, God's always there. And if you pray and talk to him, I promise you he listens. And it's such a peace for me. So I will get through this. And so tomorrow after I'm out of the surgery, don't know when, I will let you know I'm okay. But somehow when I can, I will let you know I'm okay. Not a video. I'm not going to do one of those. I'm in the hospital with a plastic thing on my head. That's not me. These videos have been hard enough because I'm really a private kind of person. But I think people need to know what's coming, and women need to know how to take care of themselves, how to try to protect themselves, what to watch for. And if you do get a diagnosis like mine with HPV leading to cancer, you know what's coming. And I will continue to share that. And I just appreciate everyone who's been paying attention in your messages. I wish I could respond to every one of them, but I've not been able to. But I have read every message that came from every platform. And I thank you all so much for your encouragement and your prayers and sharing your stories with me. And I guess I will just see you on the other side of surgery. And so as my father-in-law said, we're going to be happy on the other side of this together.